The government has banned the private sector importation, distribution and administration of vaccines. The National Emergency Response Committee has subsequently revoked any license given to a private entity until such a time when it is confident that there is greater transparency and accountability in the entire process. Dorcas Wangira reports.
The government's decision to close the window of private sector importation, distribution and administration of vaccines following a week of confusion over how up to 75,000 doses of the Russian-manufactured Sputnik V vaccine imported by a private firm landed into the country and was being administered at a price to Kenyans.
There will be no licensing of private players in the importation of vaccines, and any such license given will be and is hereby terminated. Any person advertising or vaccinating people for a fee will therefore be in contravention of Pharmacy and Poisons Board regulations governing emergency use authorization and the Public Health Act. As such, they will be liable for prosecution. The only agent for vaccination in Kenya will remain the government of the Republic of Kenya until further notice.
Even though Sputnik V had already received emergency use authorization from the Pharmacy and Poisons Board PPB, it still had not received market authorization and has not yet been approved by the World Health Organization. The government saying Kenya will not, moving forward, consider or include in the national vaccination program vaccines that have not been approved by the WHO.
We had information of people even getting vaccinated outside health facilities. And earlier in the week, you also saw advertisement of these vaccines. So the NAC considered all that, and in the interest of the safety of Kenyans, decided to stop this. Now this is the announcement that has been made. And further, we are happy that they have also adopted what the task force was recommending, that they must be WHO approved.
Private companies that had already imported doses of vaccines will now have to go back to the drawing board on how to use them. What happens to those who had already received their first dose from private distributors?
Those who took the Sputnik vaccine are assured of their second dose. You are going to work with the importer together with the Pharmacy and Poisons Board and the vaccination centers to ensure that those who have received the vaccine will get their second dose. But remember also, in a pandemic situation, the national public health security takes precedence over anything else, including business demands.
After day-long deliberations, the National Emergency Response Committee on Coronavirus recommended increased vigilance in enforcing containment measures, acquisition of more vaccines, ensuring that counties use the IT platform to account for the vaccination process, and strict observance of the phased vaccination plan. 1,851 more people have tested positive for COVID-19. This brings the total caseload to 138,893. The test positivity rate standing at 19.1%. 19 deaths have been recorded, all being late deaths. 1,597 people are admitted in various health facilities, with 185 patients being admitted in the ICU. The government is categorical that it will now be illegal for anyone to go for or to administer the Sputnik V vaccine or any other vaccine that has not been approved by the WHO in this country, and that the 228 people in their system who have already received the Russian vaccine will not miss their second dose. Dorcas Wangira, Citizen TV, Nairobi.